Joining me now is Professor Helena Danielsson. Hi, Helena.
Thank you.
You were an early adapter of this new technology, surface plasmon resonance biosensors, using these in drug discovery.
Mm-hmm.
Yes. Tell me a bit about what it was like in the beginning.
Well, the first time I came in contact with this technology, it wasn't possible to do what I wanted to do because it didn't have the sensitivity, but I was still quite curious because I needed a method that could complement our enzymatic assays, because they weren't sensitive enough and didn't give us the information that we needed to drive our drug discovery projects. And the first time when we actually used the technology, we didn't know what we would be able to do. And we were sort of testing, can we do this? Yes, you can. Can we do this? Yes, we can. Mm-hmm. And then finally, we managed to set up the assays in a way where we really see that this is very useful information.
Okay, right. So what was the useful information?
Well, if you use a standard enzymatic assay, you will only get the Ki value, which corresponds to the Kd value. So it's only an affinity parameter. Mm-hmm. But the great thing with this technology is that you can actually get the K on and the K off. So if we look at this graph, where we have the K on here, the rate constant, and the K off rate constant here, and then we look at the diagonals here. The diagonals actually correspond to the Kd, because that's the ratio of K on divided by K off. Now, since it's a ratio, you can have on this diagonal, you can have a value with a certain Kd. This value has the same Kd because it's on the same diagonal, but here you see it has a very slow association rate, slow dissociation rate, whereas this one has a fast association rate and a fast dissociation rate. Now, if you want to develop a drug, where do you want to be in this graph? Ideally, you would like to be somewhere up here, right? Mm. Something binds very quickly, dissociates very slowly, has very high affinity. But in the beginning of a project, you may start out here or you may start here. You don't know where you are in terms of the affinity. And if you start here and here, you will think that this compound has the same characteristics, same kinetic characteristics. But the optimization process for this one should go this way. The optimization process for this one should go this way. So understanding how you can resolve the kinetics through this type of a method has been quite revealing. So I think this is one of the most important advantages of this technology.
Right. So how about now? What's happening in the field? What are the new things that are happening in the field?
Well, of course, the SPR biosensor technology that was originally developed became a really important breakthrough technology. And other types of technologies have come later to try to do the same thing. They become competitors. But and some of these other technologies, and also this technology that was originally developed, they've become more sensitive, you have a high throughput and so on. But I would say that there are new additional technologies that work in a slightly different way that provide us with new information, such as conformational changes, and you can resolve more complex interactions. So if you really want to understand how a ligand can change the conformation of a protein when it binds, some of these biosensors are hugely important for this. And that's where I think that the technologies are becoming complementary, and you can really get more information about the mechanistic features of your ligands and how you should optimize them in order for them to be efficient and safe therapeutics.
Right. Conformational changes and mechanistic studies.
Exactly.
Yes. How about challenges that we face with our techniques?
The challenges are often related to the protein itself. Most of our work involves studying proteins. And we realize that the proteins may not be fully folded, or they might be unstable. So having the right form of protein that is functional over time is one of the challenges that we face. Another thing that is often a challenge is that when we start a project, we don't have any ligands that we can use for establishing our assays. So we can immobilize the protein and we can think that we have a nice sensor surface. But if we don't know that we have a ligand that reliably interacts with that protein, we can't really validate or optimize the assay. So getting the first ligand is very, very important, and a ligand for which we have other data that we can correlate the data that we're seeing from the biosensor experiment is quite important. So our struggle to find the first ligand is often the most frustrating thing in the beginning. Once we have that, then we have an assay, we can further optimize the assay, and we can compare new compounds with that original ligand that we found.
Yes, I totally agree. And some projects where we start, we don't have this reference, this known binder, so then it's really difficult to set up the assay and know if do we have the functional protein on the chip. Yes. Yes, I guess to sum up then, what do we see for the future? We're still trying to understand how to use these methods. We know a good deal about how we're using them, but what would you say?
Well, I think in the beginning when we started using this, it was difficult for the medicinal chemists to understand why do we bother determining the kinetic rate constants, because they were really only interested in the affinities, right? Now I think with this type of a graph, it's quite obvious that we need to resolve the mechanism or the KD into the rate constants, but adding additional steps now for conformational changes. How do we convince the medicinal chemists that understanding the conformational change is important? Because we can't just simply give them a KD value and think that, oh, this is the affinity. The affinity will be for the actual binding, but the conformational change itself might be the most important part of the mechanism of that compound. So for us to communicate the complex mechanistic features that we can characterize with this technology, I think is one of the challenges that we have. But once we master that, I think this is a very, very important and very informative methodology that really can help us be more clever in how to discover drugs.
Right, thank you.